Friday Dental Squad, having a beautiful day here in Peru, Indiana, and I just wanted to hop on and take a quick second and give a little bit of my opinion on some of the latest kind of expert and guru talk here in the DSO and dental space. So Dr. Mark Costas, who is the dentalpreneur for you guys at home that are big in the podcast space, he recently sold out of his dental practices, and his take is, and his opinion is, by the end of 8 years, so basically by the end of 2030, 80% of the dental market are going to be DSOs. So that's a little bit of a bold call, but a lot of people are saying, even on kind of the bearish side or the low expectation side, it'll be 60% of the market. And what I just find so interesting is, and a lot of the experts that are talking about it, and I heard Dr. Costas on the Bulletproof podcast, and shout out to them. I think they do a great job and have really relevant conversations. But it's just hard as we're going through this natural margin contraction. And as I'm headed to our Peru office here right after this video, I find it funny because I'm actually going to be meeting 3 vendors at the same time. So I'm letting Patterson in so they can run their tests and maintenance on our vacuum pump and our compressor. So vendor number 1, vendor number 2 that's going to be there is our cleaning crew. We have this office professionally cleaned 2 times a week. Just as it's a pretty high volume office, we want to make sure everything is absolutely clean and up to date and looks really good as our patients are coming in and feel comfortable getting the work done there. And then the third vendor is a general contractor that's doing a kind of painting and painting basically the entire lower level of the office, and also putting in new carpeting. So it's been about 7 or 8 years since we've done that, and it's time to do it. And the things I find fascinating is all 3 of those vendors have drastically increased their pricing since the 90s. In our model, dental insurance companies have not increased their reimbursement rates for us since the 90s. And it's the thing that all of the experts are talking about is obviously wages outside of the vendors and that cost of goods sold going up. Obviously, wages have been unbelievably hot in the last 3 years. And I think just due to the overall still labor market conditions, that wage inflation is going to continue to go north. Now, that will eventually hit a ceiling, but I don't think we've hit that just yet. So not only do you talk about the vendors increasing and that cost of goods sold going up, we talk about the wage inflation, but then just the complexities of the overall space, where to make sure you actually get paid from insurance, you actually have to have a revenue cycle manager. And the list just goes on and on. There's so much technology in the space now. You basically need an IT department. Again, where are those wages coming from while our reimbursement is decreasing year over year over year? And that's the conversation that's really being had at a high level right now, and why, again, on the small side, by the end of 2030, 60% of the market will be DSOs. And some are saying by the end of 2030, 80% of the market are going to be DSOs, just because there's not enough bandwidth in the day and there's not enough margin there to make it worthwhile. So comment down below. Let me know your guys' thoughts on this, this is a really hot topic in the dental and DSO space right now. So I'd love to get your guys' feedback. Let me know specifically in your market what you guys are seeing, as I think collectively we get stronger as an industry and as a profession as we learn together here in the trenches. So comment down below. I'd love to hear more.